Welcome back to Mountain Connections. Well, most medical professionals recommend the COVID-19 vaccine. What do you need to know right now about this? I know many people have concerns. Well, I recently spoke with an expert, a physician, all about this. Let's take a look.
As the Delta variant continues to spread and COVID-19 cases surge across the country, healthcare professionals continue to urge the public to get vaccinated. Current research shows that 90% of people dying from COVID-19 are unvaccinated. And while there's a lot of information out there about the vaccine, it can be difficult to determine what is true and what is not. Dr. Andrew Pavia, Fellow, IDSA and Chief of the Division of Pediatric Infectious Disease with UT Health, is joining us to discuss the latest information regarding COVID-19 and how to prevent the spread of the virus. Dr. Pavia, thanks for being here today.
Oh, thanks for having me.
What are they seeing and hearing from community members and patients about COVID-19 vaccine uptake?
You know, it's a very complicated, nuanced story. People have different reasons for not yet getting vaccinated. And we have to listen to all of the reasons that people have. Even if, you know, to those of us who would have taken the vaccine in our eyeball last December, if it was offered that way, it's difficult to understand. Some people were waiting for more experience with the vaccine. Well, we have that. We have full FDA approval. We've given 350 million doses in the United States alone. So we now have extensive experience and safety data. Some people were just waiting to hear advice from people they knew well and trusted. And that's often their own healthcare provider, their family physician, their internist, their pediatrician. And so hopefully that's a source of information that people are going to go to. But, you know, one of the big problems that people have gotten caught up in misinformation. And it's striking that people will listen to their doctor about having life-threatening surgery, but then a friend of a friend saying something about a potential side effect influences them not to get the vaccine. So we have to work on that kind of one patient at a time, listening to people's concerns, explaining it as best we can. Another issue which, you know, is hard to talk about is politics. Vaccination shouldn't be a political issue. It was a vaccine developed under a Republican administration, distributed under a Democratic administration, and the virus does not care whether you're a Republican or Democrat. The virus will find a way to infect you and try and kill you regardless. So we have all these challenges we have to deal with.
And what does the data tell about the COVID-19 within communities?
Throughout this pandemic, it's really been a story of many epidemics in many states and cities, and each one has a little bit of a different story to it. But the big overwhelming picture is this: Delta is extremely transmissible, and it's tearing through communities throughout the United States. It is finding everyone who's unvaccinated, and you know, if you give Delta long enough, it will infect them. And that's put a huge amount of stress on our communities, in particular on our healthcare systems. Our hospitals here in Utah are full, our ICUs are full, we're diverting patients. It's beginning to impact pediatric hospitals in a way it never did before because Delta is so much more transmissible. We're seeing lots of infected kids. Even though children are less likely to develop severe complications, only about 1 in 100 kids who get infected will end up in the hospital. That ends up being a very large number when we have 120, 130, 140,000 new infections among children every week.
And what is important to know about COVID-19 variants and why we're seeing them?
Well, why we're seeing them is just, this is how nature works. Evolution is going to move forward, and viruses want to evolve. They want to become more efficient at surviving and transmitting. And it turns out that this virus, SARS-CoV-2, has the flexibility to undergo a lot of changes that eventually select for a more perfect virus from the virus's point of view. The Delta variant is becoming pretty close to that perfect storm for a virus in that it's extremely transmissible person to person. It is easier to infect somebody, and when they're infected, they have more virus in their upper airway, and so they're more infectious to other people around them. But it's probably not the last variant we're going to see. Early on, we underestimated the ability of SARS-CoV-2 to continue to evolve, to become a worse disease. Now, I think we know that we can't underestimate this virus. And if we have huge amounts of virus replicating in large populations, there will be more variants. And some of those variants are going to be better from the virus's point of view and worse from ours. And they're going to cause us ongoing problems.
What are the symptoms of the Delta variant, and are they different from other strains?
We don't have great data on that. By and large, it seems to be pretty similar to other COVID infections. Their biggest differences that we're seeing are in the age groups that are affected. That's in part driven by high rates of vaccine in older people, but we're seeing higher rates of infection in young adults and in children than we ever saw before. The typical symptoms are similar: fever, cough, sore throat, muscle aches, and then in a number of people, it progresses to difficulty breathing. And just like the earlier variants, this virus causes a lot of weird and dangerous complications in people who are very sick. They can develop blood clots that lead to strokes, that lead to loss of limbs. They can have problems with their organ systems. So this is really SARS-CoV-2 that we saw last year in a new and much worse version.
And how can people make sense of all the information that is out there on COVID-19?
I think the most important thing people can do is to be very critical about where they get their information. And, no offense to social media, but it's a terrible place to get health information from. If you have access to your provider, your physician, that's probably the best place to start. Most local and state health departments have really good, really valid, trustworthy information on their sites. There's information on the CDC website and some trusted medical resources. The problem is we're all used to listening to our friends and getting information from this fire hose of information that comes out of it at us, but a lot of it is just bad information, and we have to learn to be more careful.
And where can we get more information and learn about vaccine options?
Virtually every state has great information about vaccine, about safety, about efficacy on its website. CDC does as well. But if you want to find out where you can get vaccinated, not only are state and local health departments a good source, but there's a really good online resource, vaccinefinder.org, that will tell you about all the sites in your area that are offering vaccine. The good news is that nowadays, vaccine's really easy to come by. It's in hundreds of pharmacies. It's in many doctors' offices. It's in clinics. It's in large hospital clinics. So you shouldn't have any trouble finding a vaccine. Remember, the vaccine is always free. A lot of people worry about the cost of the vaccine, but you should not be charged either for the vaccine, or if you don't have insurance that covers the administration, you shouldn't be charged for getting the shot. So safe, effective, and free. What more could you want?
So very true. Thank you so much, Dr. Andrew Pavia, for joining us today. We appreciate this information, this up-to-date, informative discussion about COVID-19 vaccines, variants, and much more. Thanks for your time today.
Thank you, and stay safe.